coming up today. Coming up today, can you keep the beat? On today's All Things Brain Health, we show you how researchers are using rhythm and a familiar noise, yes, sounds like a cowbell, to determine what protects your brain health. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Cowbells are not something you'd expect to see or hear when it comes to improving your brain health. But at the University of Kansas Medical Center, audiologists wonder if more cowbell could work.
I am really bad. That's okay. That's why you're practicing.
It looks simple enough. A cowbell sounds in rhythm. You click a button in time with the beat. But hitting that beat, not so simple.
I was either too fast or too slow, mostly too slow. I think I hit one, maybe. One.
Melanie Bowman volunteered for a study at the University of Kansas Medical Center, led by neuroaudiologist Dr. Lauren Mann.
Our brain is wired to hear all the time. Your brain uses timing of sound to help with motor coordination, how you move about the world, how you interact, and also how you communicate.
Dr. Mann studies how music and rhythm can train the brain, even improve recovery after concussion or slow cognitive decline with age.
So what we're looking at is how can we tap back into that timing? How can we train it even and use that as a therapeutic tool?
I thought, well, tap my foot along with the song or something, So I always thought I was kind of right on the beat. Apparently I'm not.
You got the same score.
I did?
Yeah.
For Melanie, the challenge was worth it. She says research like this matters, especially for people with a history of dementia.
I think everybody should be interested in science things and how it relates to you. And if you have a family history of, my mother had dementia, and so I definitely have interest in not going down that road.
Dr. Mann says volunteers like Melanie make this work possible and even fun.
Sometimes research isn't drawing blood and sitting in front of test tubes. Sometimes it's us playing a cowbell and clapping. And I think that research can be fun and engage the brain just by being a part of it.
That's so fascinating. Dr. Lauren Mann and Dr. Candace Coffey are both here in the studio to talk about this study. Now, Dr. Mann, as you saw, is the co-director of the Auditory Research Alliance at the University of Kansas Medical Center. And Dr. Candace Coffey is a geriatrician here at the University of Kansas Health System. Dr. Mann, first off, you brought an actual cowbell. Is that your mascot?
This is our lab's mascot. We jokingly call this the More Cowbell Project because of the famous SNL sketch. But
you gotta
give you
we
a
gotta
little
ring
small,
in the show.
Let's take it off there. Yeah, that's our mascot, but there's real science behind it.
Well, there are so many different instruments you could have chosen, so many different sounds. Why the cowbell sound?
The cowbell, what you're hearing in the study is a digital metronome. So it sounds to us like a cowbell. And I'm sure our neighbors up the hall will be glad when we're done with this project. But what a metronome does is it keeps the beat and it strips music down to its most basic component of timing. So it helps us kind of isolate one aspect of music and use it therapeutically.
So when we saw your volunteer clapping her hands together with the blue thing in her palm, she's trying to hit. What is she doing with the blue thing? What's that blue thing in her hand?
The blue sensor that she had on is what records her clap. So this is a really popular clinical tool. It's available across the country. It's used a lot with pediatrics, ADHD, autism, motor disorders. There's a number of applications, but I'm interested in how adults might use it to help recover from concussion or to maybe intervene in early signs of dementia.
So she is, just so our audience understands, she's trying to hit the sensor to the beat of when she anticipates the cowbell?
She's trying to clap along with the cowbell beat. So that's a lot harder than you might think to stay right on a set digital beat.
That's what I was going to ask you, because I would think you could anticipate it, but we also had our reporter Janine Kiesling, who did that story that we aired. She said it was really hard.
Yeah, I think I went into it thinking I would be great. I'm a trained musician. I designed the study, and it was really difficult for me too. So.
Dr. Coffey, I'm going to get to you in 1 second, but you're a trained musician? What do you play?
Well, I'm not a professional musician. I grew up playing music.
Right.
I've grown up playing the flute, the guitar. I've been in a family of musicians. My dad was a drummer. My uncle's a drummer.
Oh, wow.
So music's always been a part of my life.
Right. It's near and dear to your heart, and you're weaving it into your profession and your studies.
Absolutely.
Dr. Coffey, when you talk to your older patient population, you're a geriatrician. At what age is it that you notice the most common changes happening in your patient population?
When it comes to brain changes or cognitive changes, usually it's in the 60s or the 70s, and so that's why we recommend that you do start having those types of screenings then. And so if your doctor starts incorporating those into your, say, your Medicare wellness visits, that would be normal.
Now, 60 sounds fairly young.
It is really young, not fairly young.
To see a geriatrician, but I've also heard that we should start seeking out geriatricians before we're in our 80s and 90s. What's your philosophy on that?
I think that would be a great idea, actually. And so we do say about age 65 would be a good time, or older certainly, to start seeing a geriatrician. The reason being is that we would love to help capture any of your health conditions that are really going well and maintain those for you, and then help to bring anything that's chronic or out of control back under control and progress with you through your lifespan. And so getting to know what your goals are, what your expectations are as you head into your aging remainder of your life.
My dad always called it his third trimester. I would always say, Dad, he's like, no, I'm in my third trimester, feeling good. And he'd say that, but I love the idea of getting a geriatrician to see you through your next 30 or 40 years.
40 or longer, yeah.
Dr. Mann, I want to look at more video from your study. How do you pick your participants? How do they sign up?
We often recruit through health system clinics, so we might send out an email blast or put out flyers, but also community partners may approach us. We've been approached by roller derby leagues, other sports teams in the area.
Roller derby leagues?
Yeah.
That's awesome.
Musical groups. A lot of stakeholders in the community are interested in their brain health. They're interested in how music might be applied to their group.
Roller derby because they hit their heads when they fall?
Yeah. Groups that they think were at risk for a brain injury. They might be interested in being participants. So that's really cool when we get calls like that.
What trends do you notice and have you been noticing in your participants with what are the common traits they have if they respond quickly or slowly to the beat?
I think what most people are surprised about, first, that it's harder than they anticipate with musical training or without, but they're surprised it's not about being fast, it's about being consistent. So once you get off the beat, it's very difficult for some people to correct it, especially after a concussion, and kind of find that beat again.
With something so difficult, how do you get an accurate measure of the brain health?
That's a great question. So we have stripped this pretty complicated system down to just one of the motor functions, clapping. So there's foot tapping, there's one-handed, two-handed, a lot of things that you could do with it therapeutically. We're just getting a baseline of how our adults with concussion can clap along to the beat. And then I hope to, in the future, expand to some imaging techniques, look at the different motor tasks they could do, and help isolate what's therapeutic, what's helping in this population the most.
So this study focused on adults with concussion. However, we have Dr. Candace Coffey on because we're so interested in brain health and dementia and Alzheimer's. In your patient population as a geriatrician, what do you glean from this that you could apply to your patients?
So a lot, actually. We know that there's a lot of association with sound and memory, and also as cognitive impairment progresses, what's retained are those long-term memories. And so reigniting some of those can really be helpful in different situations, particularly for caregivers and like acute hospitalizations. Like I see patients in the hospital, there are often times where I'll ask a family member, you know, what sort of music did they listen to? What things have you noticed that calm them? And a lot of times it has to do with either music or a sound that's playing in their home, whether it's a television program or it's the gospel music that's always been playing in the house for years and years and years. And so incorporating that into their life or back into their life if it's been removed really can help. And we often recommend also when they leave the hospital or if they're in an alternative care setting to go ahead and incorporate those things. So sound also really helps with movement, and so we know as people age, one of the things that helps to slow the progression of memory loss is really physical activity. So if you have that connection of sound makes me move, I want to dance or I want to walk, that's wonderful. That physical activity helps in many, many ways.
What kinds of changes do you notice in the brain health of your patients who already played an instrument, sang in a choir, were invested in music?
Yeah, so those complex connections that have been made by learning to either sing or to play or to just listen critically help in the long term. It really helps with those complex tasks as we age. So critical thinking, processing. It's really amazing to actually see those cognitive tests on those individuals, or even ask afterhand when you look at those scores, by any chance did you play an instrument?
Oh, interesting.
It's, yes, to look back on that and find those connections.
So where would music possibly fall into the things that you might suggest a patient start taking up or trying?
Yes, I would say for everyone, listening is a really great way to enter the music world and finding what appeals to you. And because the type of music actually isn't, my understanding, Dr. Mann, it's not the type of music that matters, it's what actually appeals to you and what you find enjoyment from. But then also watching can be a way to engage the brain too. So watching somebody play the guitar, watching a choir sing, or looking at music if that also interests you, reading along with the words if you don't feel comfortable singing them. It's all engagement, and being even in a room full of others while they're doing it is physical activity and brain engagement, and really gets the eyes moving too. All can be really beneficial.
Dr. Mann, what's your take on that?
I completely agree that I think for a lot of people it's the social connection that music brings us together, whether you're a participant or whether you're in an audience. It's that human connection that inspires our brain to light up and be active and engaged. So that's what we're hoping to tap into therapeutically to kind of assist with the medical treatments we already recommend.
The therapeutic part is super interesting because when my dad was first diagnosed with Alzheimer's disease, the doctors, this was in another state we happened to live in briefly at the time, suggested to my mom that he start playing an instrument. And so she got a ukulele for him. That's my dad with his ukulele, which was hilarious because he would just be sitting at the kitchen table playing his ukulele, trying to learn new songs.
That's wonderful.
Is that something, Dr. Coffey, that you could see your patients also doing that could help their brain?
I think it's a wonderful idea. Kind of like when you were young in school and your teachers recommended that you just try a recorder, right?
Yeah,
I think
or
all
the
of
piccolo.
us, right? Anything. Yeah. And part of it is just the motion of movement, or the rhythm, even the strumming of those instruments, of the strings, can provide vibration that connects in different ways. So whether you have previously played or not, it's fun to just even try. And there's such a variety of instruments out there. It's a lot of fun.
She would take him to the symphony as well, and he enjoyed that so much. We already have some great questions coming in and some comments. If you have a question or a comment that you would like us to read out loud on the program, you can send it to us right now on the links on your screen at our Facebook page or on our YouTube page in the chat section. We want to bring in a third guest who has a little show and tell. We have Jim Kelly. Come on over here, Jim.
All right.
And bring your props with you.
Yay, Jim.
Okay, Jim is super cool. He got here early. He brought his bells. we're going to get to why he brought these. What are these bells called, real quick?
They're handbells.
Handbells.
Yeah.
All right.
Think of them as, I guess, liturgical cowbells.
Okay.
Just so much of the music written for handbells is sacred.
Oh, yeah.
So we play them in church. We have a group of about 12 to 15 people that play. And it's very interesting. It's fun. You're assigned 2 or 3 bells. You're reading a piano score and looking for your notes.
Oh, that's
And
neat.
it's it's completely different from anything else you've ever done.
Now, you took part you were one of the participants in the Cowbell study for Dr. Mann.
Yes, I was.
Now, you are a musician. You actually do bells as you're a bell guy. So how hard was this?
It was surprisingly difficult. I think you even said that it was harder than you think, and it was difficult. I learned to play the trumpet 60 plus years ago.
Wow.
I was 10. Well, so 60 years ago, I guess. I switched to horn a couple years later. I've started ringing bells in high school. I can play piano, a little bit of piano. I'm taking piano lessons.
Wonderful. So you're still learning and learning new instruments.
Still learning, yeah.
You're also part of this incredible chorus. You perform with Encore KC, which is the only community chorus in Kansas City focused on music for people that are 50 or older.
50 or above. We have a 501c3 foundation.
We have some music of yours that we want to play. Let's take a listen.
Let's do that.
Okay, you guys are really good. Is that Queen? Don't Stop Me Now?
Yeah. Yeah, that was Queen.
You didn't mention you performed Queen.
Well, Queen, we do. This particular concert, we did stage, movies, radio, songs.
And where was this concert?
This was at Grace United Methodist Church in Olathe.
Okay. Do you travel around to different churches and perform?
We have performed at a couple different churches. Because of the size of the group, I think we have 90 members in our group now.
Wonderful.
Because of the size of the group, it's a little bit difficult to travel.
Sure, you got 90.
Yeah.
You need a bunch of school buses for that.
We do have three choirs. We have the big choir here. We have a smaller choir called Act 2, which is 20 people or so, and it's easier to travel. And we've played for community functions. We've sung for Christmas things. We've sung quite a few times, different places. We also have a soprano, alto, women's choir. We also have a brass group, Encore KC Brass, Encore KC Woodwinds, Encore KC Ukuleles.
Oh, you do?
We do.
Oh, that's
so
so
your
sweet.
dad, I'm assuming your dad is over 50.
Well, yeah, he passed in March.
sorry.
No, it's okay. He would like the attention. He passed in March, and he was one day shy of 81, but he loved music, and I just know he would have loved to have either joined or watched your performances. What changes do you notice with newcomers?
They're surprised by the social aspect of the group. You know, we're trying to get. We have a couple of 90-year-olds in the group. We celebrate their birthday. Well, one didn't want to celebrate her birthday, but we.
Oh, you should celebrate every year.
Every
oh my
year.
gosh.
So we have a lunch every month where after rehearsal, we go out to a restaurant. We make arrangements with the restaurant because there's usually 40 or so people that come in.
Wow.
So they're surprised by the social aspect of the group.
Which is what Dr. Coffey was saying is so important.
Exactly right.
To stay engaged.
We get them out of their house, you know, or their apartment or their assisted living. But we get them there, and whether they sing well or sing not so well, they're a welcome part of the group. This is a non-audition group.
You just join.
You just join. We do limit it because of the size factor, so
It's a good problem to have.
it's a good problem to have.
Can you play something for us with your bells?
Well, I'm going to ask for your assistance because
Okay.
there's
Oh, I
4
like
bells and there's only 2 hands.
Okay, okay.
So when we play in a group, we're each assigned 3, 4, 5 bells, and like I said, you look for your particular notes. And if I did this right, I'm going to give each one of you a bell,
Is that for Dr. Mann?
whichever.
Okay.
Each
These
one of you
aren't
a
bell
bell.
specific.
The
Okay.
bigger the bell is, the lower the pitch.
Okay.
We go down to what's called C3. This is C5, so that's 2 octave difference. C3 is about this big around and about this tall, and it weighs about
some big
16
bells.
to 18 pounds. So try doing that with one hand, right?
That's a good
it'd be hard.
workout.
Good workout.
There's a crown on one side of the handle, so that crown
Got it.
needs to be up,
Got
Okay.
it.
okay? And then you just flick your wrist. Okay? So, and then
like
to
that.
dampen them, you just, okay? There's 20 different ways. You have mallets.
I love these
So,
tones.
yeah.
Cheers. Cheers.
So if we all play them at the same time, it should be a rather pleasing sound. So
Okay,
on
just-
1, 2, 3. So
like
that's a
that.
C major chord.
Beautiful.
So I should have brought the E flat in, and we could do a
There's
C minor
something
chord.
calming about the tone.
Yeah, these
Why
are
is
much
that?
nicer than the one in the study.
Then this guy,
Yeah, that would be.
Cowbell guy.
Yeah,
We need Will Ferrell.
yeah. They're a little more musical.
Yeah.
So it's an interesting time. It's a fun time.
So great.
So
Can we do one more?
yes.
Okay.
1, 2, 3. And as long as you're supposed to keep them moving to keep the
shoot, all
sound
right.
going. That's okay.
Kind
One
of
more
like,
time.
like incense.
Yeah, 1, 2, 3.
Oh, I meant to. Can we try that one more time? I feel like I need to go out on a
Everybody
powerful
dampen.
note. Okay,
Everybody
ready?
dampen.
Okay.
And then 1, 2, 3. And when you got 12 people trying to ring their bells at the exact same time,
Yeah, that's.
it's a challenge.
I feel like you just can't help but smile.
No,
Yeah.
No, it
Yeah.
makes me so happy. Jim, thank you.
Very much. I apprate
are wonderful.
the opportunity to
wonderful.
talk about
Oh,
it.
this was so cool. What a treat.
What a treat.
Let's hear it for Jim.
Hey, thank you very much.
Thank you so much. We want to go to some questions from our community. I got so enthralled with that my chat yet, but I know the questions are there. We have lots of them. Okay, Marcia wants to know, do other creative tasks have the same effect on the brain as playing music, like sewing, painting, or drawing? It's a great question.
So from the standpoint of a geriatrician, we would recommend that if you have those interests, absolutely continue those or explore them if you've never have. They're not quite the same, but they definitely have positive benefit when it comes to cognitive impairment and maintaining brain health. Absolutely.
Joellen has a question. She wanted to share. I think most everyone has had the experience of hearing a song and instantly being taken back to that time. That's so true. I can even smell the way the air smelled.
Yes.
Why would that be, Dr. Mann?
That's a really great question. And music, especially familiar music, it can tie us back to memories and really activate that part of our brain, which is why I think, especially around the holidays, it can be really reminiscent and nostalgic for people, or it can be difficult to hear certain types of music. So, and you know, the music itself, there are notes that can evoke that same kind of emotional response from us, or make us happy, make us relaxed. So yeah, choosing the music to take you transported back to a place and time when you had a great memory is a great way to experience music.
It feels like it's just the tip of the iceberg that we're learning about what music does for the brain and different sounds. I remember visiting my dad, and a musician would come. His last year, he was in an assisted living memory care center, and every Sunday someone would come and sing with their guitar, and it was like, it was so cool. It was like the Pied Piper. She'd sit out there and just start playing her guitar, and then everyone would slowly just start coming
Move
out of their
towards-
rooms
yes.
and gather. They were just drawn to the music. Peggy wants to share, what a great program for me today. Thank you. Thank you for watching, Peggy. And then Jeremy Yenser writes, this conversation reminds me of the interview last week with the guy who had the high school football brain injury and how they approached rehab. that was really cool. We had a man on who 10 years prior had gotten a brain injury playing football, and he had the most beautiful way of rehabbing with his dad. Jeremy wants to know, does anything complex and new to your brain help protect your brain in addition to music? Like would learning a new language or being bilingual help protect your brain from developing Alzheimer's?
I don't know that it helps protect, but it definitely engages your brain in a new way, in a new complex way. And so I would encourage anybody who has an interest to explore other languages. Absolutely. Those neurons are firing in different new ways, and making you do more and be more active with your brain. And then same with your new language, like we were talking before, it's going to encourage you to be more social, trying it out and using it, exploring new situations and experiences with it, which are all going to be helpful with your brain as you age.
And even learning ASL as a new language. We have a signer that joins our programs every morning, and that in itself is a whole interesting new language and a way of communicating. Lisa has a question for you, Dr. Coffey. She writes, doctors prescribe physical or occupational therapy. What about prescribing music therapy?
I would love to prescribe more music therapy. One of the limiting factors is we don't have as many music therapists out there. I wish we had more. If anyone is interested in exploring the world of music therapy and becoming a music therapist, I would encourage you to do it.
So you can prescribe music therapy?
Yes, you can.
And insurance, does it cover it like
now,
it would?
I'm not quite sure about that. I do know that I am able to engage music therapists, especially in my nursing home population and in my assisted living patients, but my understanding there is that the facility is actually engaging that individual, and so I haven't asked for that to come through billing or through a charge yet, so I need to explore more on that.
Insurance is always tricky, but so great to hear that you can prescribe that. Johnny has two questions for you, Dr. Mann. Johnny wants to know, for your study, what is the age range of the participants?
This study is looking at adults. A group in Northwestern has already looked at concussion recovery in children using the system, found some really great data. So I wanted to see, with all the things that make our lives complicated as adults, noise exposure, aging, hearing loss, would we still see the same benefits from using a system like this as an adult? And could I get adults to even get buy-in and want to clap along or do these silly games with me in the first place? Well,
that goes to the one of the other questions we have. Annie wants to know, how can we join the study? Are you still looking for new participants?
Absolutely. The concussion group we're recruiting from the health system, but we're still looking for normal participants. And we always love to get a pool of people who are interested in volunteering. This may not be the right study for you, but there could be things that we look at in the future that we could contact them about.
And do people watching who aren't current patients or in the current bank of patients you have here, do they go online and sign up?
Yeah, you can go on KU Medical Center's website, kumc.edu, and then Aura Lab, AURA, has its own webpage, so they can find out more.
Second question, or Johnny's second question was, when do you expect to see the results or publish your findings?
You know, Johnny, I would like to know that too. Research takes time, and it just really depends on volunteers. If everybody runs in and we get it collected and written up quickly, it could be months. But for a project like this, usually it's wrapped up in around a year time frame. And we're hoping with this pilot data, this is a small study, that we can get larger grant funding to explore more of the aging effects, more of musical protection, and look at other things, even like tinnitus and how that changes, you know, what's happening in your brain with music.
Oh, the ringing in the ears.
Absolutely.
One more question we have from Lori, and this is for you, Dr. Coffey. She shared, my mom was just diagnosed with Alzheimer's. What can I do for her music-wise?
Yes, I would say just start at first by playing the things that she loves. If you're not familiar with what she likes, then look around her house. You know, I've recently found all of my parents' old albums and enjoyed just listening to them and playing them with them. Try some things online, and also then jotting those things down, because then you can explore further. Try instrumental music as well, if you find that perhaps music with words is not producing an interaction or an engagement that you had anticipated. And if you want to take your mom out to listen to music, that social interaction, try to incorporate something else with it that might make the experience a great one. Like if there's a little bit of walking and you can look at different things on the way, or if having a warm cup of cocoa with it too, and then talking about different memories also can really pull all that together.
One final comment from Joellen McGranahan. She writes, love this guest. She's talking about Jim, and I also love the doctors. More programs like this, please. Joellen, we will do that. Anytime we can have bells on and music.
Yeah.
This has been really neat. For today's takeaways, Dr. Coffey, I want to start with you. What do you want our viewers to most take away from this conversation?
To really listen and watch when you're seeing a performance. Challenge yourself. What do I think that sound is coming from? Is that coming from a French horn? Is that coming from a clarinet? Pull out all your music if you haven't listened to it in a while, and just get back into it. Sing, even if no one's around. All those things really engage different parts of your body. And also, if you want to dance, it's okay to dance in your chair. It's okay to get up and move too if you're able to do that, because it engages all those muscle groups too. So really enjoy music and as long as you can.
Sing like no one's listening, dance like no one's watching.
That's
right.
That's
Dr.
great
Mann,
advice.
what would you like our viewers to take away?
I think from this study and just in general about engaging music is that rhythm is something that we can train, and you don't have to be born with it. You don't have to be good or proficient at an instrument to engage with music and get some therapeutic effect from it. So I think that's really exciting that our brains are built to listen to music, and any time that we can interact with others and enjoy music together, it's going to be good for our brain.
Dr. Mann, thank you. Dr. Coffey, thank you. Thank you both for taking the time. And thank you to our viewers for joining the conversation today. Coming up tomorrow on Open Mics with Dr. Stites, learn how a new center of excellence with the University of Kansas Health System, Children's Mercy Hospital, and the University of Kansas Medical Center is helping patients like this Overland Park woman and her mom with very rare diseases.